Now, the next important topic in the cardiovascular system is the central venous catheter or the peripheral inserted catheter. So let us first understand what is the central venous catheter. The central venous catheter, which is also called as a central venous access device, CVC or CVAD, it is a flexible small tube that is inserted into the vein of the neck, chest, arm or groin, leading to the vena cava near the heart. To qualify for as a central venous access catheter or a device, the tip of the catheter or the device must terminate into the subclavian, brachiocephalic or iliac vein, the superior or inferior vena cava or the right atrium. So basically in the central part of the your body, and all the vessels where you are putting the catheter and ended up into the right atrium. Now it is used to draw the blood and give the treatment, including the intravenous fluid, drugs or blood transfusion. If the jugular subclavian or the femoral or the inferior vena cava is used to insert the catheter, then we call it as a central venous axis. Now let us understand the PICC, which is the full form is peripherally inserted central venous catheter. And in this case, the catheter is inserted through the periphery. That is, we'll use the basilica cephalic saphenous vein, and it is used for the short-term access. So we use the periphery of your body to enter, to put the catheter, and then it ends up into the atrium, but the beginning part is the periphery. So that is called as a peripheral insertion. So basically the main classification is centrally inserted and peripherally inserted, and centrally inserted is the jugular vein which is there in your neck, subclavian vein which is there in the chest side, and the femoral vein which is femoral or the inferior vena cava, which is also the central part of your body. While the peripheral is basically the basilic, cephalic and the saphenous vein. So many a time the name of the vein will give you the idea whether it is a peripheral inserted or a centrally inserted. And in your book also there are plenty of illustration where in case if you are stuck to understand whether it is a central or peripherally, you can take the help of those diagrams. So the second important concept here is the tunnel. Two types of central venous catheter. The tunnel CVC are placed under the skin and meant to be used for a longer duration of time. Tunnel central venous catheter, they are suitable for access lasting more than 2 weeks and inserted by tunneling through the space under the skin and have both entry and exit site. The catheter tunnel under the skin for 8 to 10 C. So if you see here, I mean, this is the vessel where we are going to enter, but the entry point is here. So from here, and there is no vessel here. So from here till that vessel, we dig a tunnel and then pass the catheter in between the skin, under the skin until it enters the main vessel, and that is called as a tunneling. Non-tunnel catheters are designed to be temporary and may be put into the large vein near your neck, chest or groin. So non-tunnel means whenever we are putting the tip of the catheter directly into the vessel. So that is called as a non-tunneling, where we are not digging the tunnel like this. We are directly putting the catheter tip into the vessel. Non-tunnel central venous catheter used for a short-term access, like for example, we are giving the IV therapy or short-term procedures and inserted directly into the vein without any tunneling. So the third important concept is a pump or port. A port is a small implantable device that provides access to a large vein, typically in the upper chest, for delivering the chemotherapy and therapeutic medications. While the chemo pump is a device that delivers the chemotherapy drug at a controlled rate. So if you see, this is the device and this is called as a pump or port, and you will inject the medicine in this and we can control its control the medicine that goes into the system of the patient. The fourth important concept in this particular chapter is the image guidance. When image guidance is used for centrally inserted central venous catheter for gaining access to the venous entry site and or for manipulating the catheter into the final central position, image guidance code, that is the 70,000 series, may be reported separately. But there are certain codes on which we cannot use the image guidance code. So do not use the image guidance code in conjunction with this code, because if you see this particular code 36568, the language of the code says insertion of the peripheral inserted central venous catheter without subcutaneous port or pump without image guidance. Okay, so there are certain code where it is very clearly written this code is not for the image guidance, without image guidance. So on that we cannot use the image guidance code, and there are parenthetical notes below every code. So kindly read the notes very carefully so that you will never go wrong. So what are the steps one must take to solve the question? First of all, identify the catheter, whether it is a centrally or peripherally inserted. If it is not given directly, identify which vein is used for the catheter insertion. Okay, because many a time they will give you the name of the catheter, but if they want to test your knowledge, rather than giving the CVC or PICC, they will say that the catheter ended in the cephalic or the catheter started with the subclavian. So that will also, you should be able to find out. And I would suggest that at the beginning of the central venous axis codes, you will see this paragraph in your book where all the vessels are also given. So in case if you are during the exam, if you are stressed and you don't know where to look for, you can quickly check this paragraph. Identify tunnel or non-tunnel. If not mentioned, default is non-tunnel. So this is also very important consideration. Then identify the catheter is with or without pump and port. If not mentioned, default is without pump and port. And then the fourth important point is the age of the patient, because the code varies depending upon the age of the patient. And the fifth important point is the image guidance. This is the table which is there in your book. You can very well master the table. It is very easy to understand, but many students find it a little confusing. So the best way is to go to the particular code and read the code language. So let us take certain questions that will, make this concept more easy to understand. A 2-year-old male required a centrally inserted central venous catheter. Using xylocone local anesthesia, percutaneous approach is used in the neck and a venous access is achieved. A subcutaneous tunnel is created from the interior chest wall to the venotomy site and the catheter passed through the tunnel. The CV catheter is then placed at the superior vena cava and sutured in the position. Which procedure code is reported? So let us collect our data. Identify the catheter, is it central or peripheral? In our case, it is very clearly given it is a central. Then second is identify whether the tunnel or non-tunnel, subcutaneous tunnel. So we have second important point. Third is identify the catheter with or without pump and port, and if not mentioned, default is non-pump and port. Nothing like that has been mentioned in our scenario. So we will take it no pump and port, and the age of the patient, and age of the patient is 2 years. So we have enough data. So let's start eliminating the wrong option. So 555 is insertion of the non-tunnel central venous. As is the tunnel. So 36555 goes away. Insertion of tunnel centrally inserted central venous catheter without subcutaneous pump and port, and this is the something that is there. Now we need to check further what is the age of the patient. Age of the patient is younger than 5 years. So let us collect all our data. 36560, it is the insertion of the tunnel centrally inserted central venous access device with subcutaneous pump and port. In our case, there is no subcutaneous pump and port. And then we have a 568. It is a peripheral inserted. So option A goes away and option B also goes away, but it is because it is talking about non-tunnel, as is tunnel. So let's find out our correct answer. So our correct answer is 36557. because it talks about central venous access catheter. It is tunnel and the age of the patient is also appropriate. At the patient bedside in the hospital, a PICC line is inserted using xylocaine, local anesthesia, aseptic technique, and ultrasound guidance. A 21 gauge needle was used to aspirate the right cephalic vein of 72-year-old patient. When the blood was obtained, a 0.018-inch platinum tip guide wire was advanced to the central venous circulation. A 6 French dual lumen PICC was introduced through a 6 French peel away sheath to the uh, uh, saphenous vein under right atrium junction, and then after removal of the sheet, the catheter was attached to the skin with a stat lock device and flushed with a 500 units of heparin in each lumen. A steroid dressing was applied and the patient was discharged in an improved condition. Code the procedure. So let us have our drill. What are the important data that we can collect? That this is a PICC line, and then the cephalic vein is there, 72-year-old patient is there. There is no mention of the tunnel or non-tunnel, neither there is a mention of the word port or pump. So, and we have the enough data. So let us zero down our answer. So let us see our final answer. The first code is 36565. It talks about the insertion of the CVC. Our line is PICC. So I cannot even take that code. 36556 is also CVC. So I will not even go into the detail of the code. Now 36569, it is the insertion of the peripherally inserted central venous catheter without subcutaneous pump and port and without a image guidance. Now in our case we have taken the image guidance. So let us see the code D. Now this is a code that is 36573. It is the indented code. So I'll be reading the above code. Insertion of the peripherally inserted central venous catheter without a subcutaneous port and pump, including all image guidances, image documentation, and all associated radiological supervision and interpretation required to perform the insertion, age 5 years and older. So this code fits our documentation, and we'll pick up that code. The patient is 67-year-old gentleman with a metastatic colon cancer, recently operated on for brain metastasis, now for the placement of an infuser port for continuous chemotherapy. The left subclavian vein was located with the needle and the guide wire was placed. This was confirmed to be the proper position fluoroscopically. A transverse incision was made and subcutaneous pockets created just inferior to this. After tunneling, the introducer was placed over a guided wire and a power port line was placed with the introducer, and the introducer was peeled away. The tip was placed in the appropriate position under the fluoroscopic guidance and the catheter trimmed to the appropriate length and secured to the power port device. The locking mechanism was fully engaged, the port was placed in the subcutaneous pocket, and everything set very nicely fluoroscopically. It was secured to the underlying soft tissue with a 2.06 stitch. What CPT code are reported for this procedure? Now we need to collect the data. What is it? Important thing is, what is the age of the patient? 67 year. Then we have put the pump and port, infuser port, so that has been put. Which is the vessel? That is the subclavian vein. Now here they have done the smart thing of not giving you whether it is a central or PICC, but they have given the name of the vessel. So we have the name of the vessel with us, and then of course the tunneling has been done. That is also was mentioned here. So the tunneling is done. The 67-year pump infuser port, fluoroscopic guidance is taken, and we need to find out what is now, whether it is a centrally inserted or peripherally inserted. Now the vessel is the subclavian vein. So we have the data, we'll put it in the answer. So correct, it is a subclavian vein, that means it is a CVC. So we will take the code 36561. It talks about insertion of the tunnel, centrally inserted central venous access device with a subcutaneous port port, and 36560 it talks about younger than 5, while 36561 talks about age 5 years and older, and our patient is 67, so we will pick up the code 36561. But there is no mention of the image guidance, and we have taken the fluoroscopic guidance, and for which we are going to put the code 77000126. So that will be the final answer. The next question is 35-year-old female patient with a venous catheter required a blood sample for the hematology testing. The sample is collected via her PICC catheter. How would you report this procedure? So what they have done is the collection of the sample, but that has been collected by the PICC. So just go through all the options and we can zero down our correct option. So the D is unlisted procedure, vascular surgery. Then the next is collection of the blood specimen from the completely implantable venous access device. Okay, so this is one of the code which we will think. Then 36415 collection of the venous blood by venipuncture. They haven't done the venipuncture. Already the line is there. They have just taken the blood from that. And 36592 collection of the blood specimen using established central or PICC catheter, venous not otherwise specified. So in between these two we are going to collect the data 591 and 592. And always remember, whenever the language of the code is that specific and if it matches with your documentation, you will pick up that. So yes, 36592 is the correct code because we have collected the blood specimen from the peripheral catheter which was already in the place, and that catheter is not otherwise specified whether it was tunnel, non-tunnel, or whether the pump port or nothing, no specification, but yes, we did collect the blood from the catheter. Physician placed centrally inserted tunnel central venous access device with subcutaneous pump in a 7-year-old patient, and we have the option. So let us rule out the wrong option. So the first is 36561. It is the this is code is there. Then 36563. It is the code of the insertion of the 10 a tunnel centrally inserted central venous access device with a subcutaneous port, and we need to check the age of the patient. Then this is 36560, this is the code, and 36558. So 558 is insertion of the tunnel centrally venous catheter without subcutaneous port, and this is the code with the subcutaneous port, and in our patient it is with the subcutaneous port. So let us see what's the answer. So yes, 36563 is the correct code because it talks about the central venous catheter, it talks about the tunneling and the pump and port, and of course the age of the patient is above 5 years, and in our case the patient age is 7-year old. So we will definitely take that answer. Now the pre-operative report or the operative report, and remember, according to the new CPC exam format, you will expect a 10 question on the operative report. So here it is the acute renal failure is the pre-operative diagnosis, and post-operative diagnosis is the same, and indication is patient is 23-year-old critically ill woman who went to the operating room for the lung transplant. A vast cath was indicated to proceed with a CVVHD upon arrival in the ICU. Procedure is left subclavian vast cath placement. The left chest was draped and prepped in the usual sterile fashion, and the patient was placed in the Trendelenburg position. The subclavian vein was readily located with the needle, and the Selinger technique was used to place the vast cath for dialysis. The excellent flow was returned through both the lumen. The catheter was secured in a place and the sterile dressing was applied. The patient is to be transported to the ICU where the post-procedural X-ray will be taken. And we have the code, and of course this is the ICD code also. Now if you see the ICD code, there is only one code which is different. So we'll be concentrating on finding out the correct CPT code first. So whenever we are reporting the operative report, we need to highlight what the important thing. It is the procedure is left subclavian vas cath placement. Now here they have given the vein, so we can find out whether it is a centrally placed or peripherally placed. And acute diagnosis is acute renal failure. Age of the patient is 23. And then we need to check whether it is a tunnel or non-tunnel. Here they haven't given, so we assumed it is non-tunnel because usually they are supposed to give, and if it is not given, we can assume it non-tunnel. Pump and port is not mentioned. So, since it's a subclavian vein, we know that this is a central venous at CVC, and for that, we will first zero down between peripheral and central. We will require a centrous catheter. Then it was non-tunnel because tunneling is not mentioned, and we have a guideline that if it is not mentioned, we can assume it is a non-tunnel. Age of the patient is 23-year-old, and there is no mention of the port or pump. So if you see this insertion of the non-tunnel centrally inserted central venous catheter, younger than 5, this is above 5. This is everything is there, but it is without pump and port, but it is they have mentioned tunnel, so we cannot take it, and this is the insertion of tunnel centrally inserted central venous access device with subcutaneous port. So the answer will be 36556. So this is a very, very important. Try and practice more and more operative report, and I told you how to extract the required data from the documentation and how to zero down your code. So this is where we have finished the CVC. Important point, always remember. And now the next topic is ECMO, ECMO or ECMO.